Almost anybody that contacts you, you have a contribution. You may not be the only thing they need, but you always have a contribution. So we have an outpatient clinic and we also have an inpatient clinic. At the inpatient clinic, they come and stay for a week. I have lots of chiropractors and medical doctors come to the inpatient facility because they get concerned because of what's going on with their health. One of the most common things I get calls for is diabetes. Some of these people have been on medications for 15 or 20 years. Rarely do they still have diabetes after 1 week. We use a digital x-ray equipment in our office, and we use a computer to analyze the film, so we digitize every joint space and we make very accurate measurements of joint height, joint alignment. The green line represents normal and the red line represents an abnormal biomechanical side of her lumbar spine. And the only thing that's going to change that is somebody going in and helping her get her spine healthy again. And it takes a lot of work. It's not going to happen in 3 or 4 or 5 visits. You got to sit on it. You got to own it. You've got, and never limit the patient's upside as to how much they can get better. All right. If I had more time, I would just sit here and tell you about stage 4 cancer patients that everybody's given up on that have gotten better just because we don't give up on them. We give them a chance. Chiropractors out in the field, they look at these and they go, "That's crazy, Dr. Martin. That's not even possible." Well, you can't make it up. They're X-rays. The more you're going to watch how wonderful the adjustment is and how wonderful their nervous system is and how wonderful, and I'll come back and when I see you and I'll go, "Hey, it's not our job to limit their upside." The patient's upside is much higher than you can imagine if you will just do what you're taught to do while you're here.
We want to thank Dr. Martin for coming. Just absolutely outstanding.